tell better than I do.
He said he got up and gave a talk, and there were 3 people in the audience. And at the beginning of the lecture, one person got up and left, and so there were just 2. And then halfway through, there was 1 person left. So he finally says, I don't have to give this talk. Let's just go out to the restaurant and have a beer and talk over the material. And the guy says, I can't. I'm the next speaker.
So please don't pull that out.
Heck no, let's go.
Well, the beer maybe, but
That's funny.
So when what's the wait? Is that what
oh, she said go ahead and start.
Oh, okay.
So I'm going to close this door up here because it's kind of echoey.
Okay. All right. Well, Bill and I have taught for many years in the School of Medicine, and I started doing smoking research in about 1972, and I've been interested in smoking for a long time. And I've got nothing but respect for how difficult it is with smoking. I ran the Stop Smoking program at the Veterans Administration for 24 years. Where Bill was chief of psychology at the time, and we took the hardest core smokers. It was a lot of fun. Our average participant smoked for 35 years, actually 36 years, and an average of 30 cigarettes a day. And that was our average person. We had people way in the high end as well. So we took everybody, and we would tell them, you can keep coming as many times as you want to. We don't care. You don't have to, even if you don't quit this time, if you quit for a short time, come back next time. And so people would do that. We'd have as many as 50 people in the class there at the VA. It was really, really fun. Anyway, so what I'm going to cover is the first part of my talk is going to be about the smoking research and some of the things we know about how to help people quit smoking. Bill's going to focus specifically on hypnosis and smoking. Bill is I would call him a national expert, maybe international expert in hypnosis, and so he will emphasize that part of it. So, talk about the importance of cigarette smoking, understand the research behind it, and understand the steps of quitting smoking. And not to out anybody, but how many of you actually smoke? Okay, 3 out of 4. And how many have friends who smoke? Everybody, or family, whatever. And the point is, it's something that touches most people. About 21% of U.S. adults smoke. A lot of middle schoolers use tobacco, and of course now vaping is becoming very popular, and that's a way that a lot of people start with nicotine now. Originally, the tobacco companies actually have economic interest in the vaping thing. It was originally designed supposedly to help people quit smoking, but a lot of flavors, a lot of different things that are attractive to young people, and it really is a gateway for a lot of people to start a dependency on nicotine. About 50 million adult U.S. smokers worldwide, over 1 billion, and by 2025 it's going up. And a lot of it is exported from the U.S. We export tobacco products. So, about 3,000 U.S. children and adolescents become regular users of tobacco every day. So that's a lot of young people. And the tobacco companies know that their challenge is not to market to people who already smoke. Their challenge is to get new people to start smoking. And they do subtle strategies, including product placement in movies. If you go to a movie, you probably notice it, especially if you're a smoker. When someone smokes on screen, you notice it because it gives you an urge to smoke. It's a trigger to smoke, but it's also for a young person who doesn't yet smoke, it's modeling for what smoking looks like, how to do it, and so forth. And so they will even try to get their products placed in PG-13, different, for young kids who smoke. Take it up, impossible. Most people have tried to quit at least once. About 44% try to quit each year. About half of everyone who has ever smoked has quit smoking. So I tell you those things because it's reason for optimism. And the truth is, the more times you try to, I'm going to not get ahead of myself here, just a little bit. I'll tell you that. There's something about the more times you try to quit. Anyway, the smoking consequences. It doesn't work to beat people over the head about it, but there are, 500,000 deaths, early deaths each year in the U.S. from smoking, more deaths than all these other conditions combined. Huge costs economically. Environmental tobacco smoke, in some studies, there's estimated to cause up to 50,000 early deaths, mostly from heart disease, in households where there's smoking, if there's a lot of exposure. And smoking during pregnancy accounts for 10% of infant deaths in the U.S. And quitting smoking, or quit smoking counseling, is second only to childhood vaccinations in terms of prevention value. So, I'm not going to bore you with that. A lot of people didn't know this. This is the real reason dinosaurs and there's a cultural thing. Internationally, it varies from country to country. In some countries, a fewer percentage of men smoke. In other countries, more smoke. In some, like in some of these Asian countries, a small percentage of women smoke, China, India, etc. But in these other countries, Brazil, Germany, UK, Spain, a higher percentage of women smoke. So there are gender differences depending on the culture. And let's see, about 70 to 85% of smokers say they would like to quit smoking. So vast majority of smokers say, I'd like to quit, I just don't know how to do it, it's hard to do. So we're going to tell you how to do it in case you decide you want to do it. Now this is an interesting slide to me because it shows how challenging it is how easy it is to get dependent on nicotine. This is the percentage of people who have become dependent if they've ever tried tobacco, heroin, cocaine, or alcohol. And you can see you're more likely to become dependent on tobacco if you've ever tried it than you are heroin, cocaine, or alcohol. Pretty surprising, really. That's how much it can hook you, how easily. Chewing tobacco and also vaping, of course, is an issue, particularly for young people. Any baseball fans? Anybody? Oh, baseball? No. I mean, baseball players are notorious for.
I'm an enthusiast.
Yeah.
Right, there you go. Yeah.
They're notorious for. It's part of the culture in a lot of cases. And this picture, this next thing slide I'm going to show you is a very brave young man. He was, his name is Sean Marcy. He was Tallahassee High's, this is in Oklahoma, Tallahassee High's most outstanding athlete. He had won 28 track medals, and after a 10-month battle with rapidly spreading cancer that started on his tongue, he died at the age of 19. There he is. But he was a very brave young man because he wanted to alert other athletes about the risk. And so he said, you can use my picture. And he had used smokeless tobacco from the age of 12. So that's just by way of honoring him and his courage that I show you this. Okay? So one of the best ways to address smoking is to prevent young people from starting. That's called primary prevention. But you have to figure out a way to reach these kids. And one way they're experimenting with is computer imagery technology to show people how smoking can cause you to age more quickly. And so they're trying to take young people and say, okay, let's digitize and age your face to show you what will happen if you continue to smoke for X number of years. And so that's some of the things they're experimenting with, because young people don't look far enough ahead, and so they don't consider it. But this is something that they can, is meaningful to them. So it's trying to find a message that will hit home. So they're trying experiments for that. But the most common myth, is it okay if I walk back and forth here?
Yeah.
Okay. The most common myths associated with smoking that keep people from even trying to quit are these. I've tried to quit before and haven't succeeded, therefore I can't quit. Number one. Number two, I've smoked for so long, there's no benefit in quitting now. What difference does it make, right? Now, what I can tell you about the first myth is if you've tried to quit before, you have a better chance of quitting in the future. There's a practice effect. The more times you try to quit, the better your chances are to quit. So instead of being discouraged about prior attempts, I want you to be encouraged. What's the longest any of you have quit smoking before?
24 years.
24 years? Great predictor. You got an excellent chance of quitting again.
It's been 8
Okay.
years since I smoked cigarettes.
And then,
I've been smoking all along.
what's the longest period you've gone without?
Oh, probably a week.
A week?
Hour.
Okay.
No, I don't have to. I don't get like this.
Right.
I gotta have one.
Yeah.
I can, depending on the situation where I'm at and what I'm doing. If I'm busy
Yeah.
or I'm in the hospital.
Well, but you've gone for a week. That's your practice pick. What about you, sir?
18 months.
18 months. Okay, excellent predictors. You have some experience. You know you didn't go crazy. Because that's one of the things a lot of people think is, well, God, if I quit, I'll just lose my mind. But you quit for 18 months, you didn't lose your mind, as far as we know, right?
Well, that was.
It's still, even if it was a long time ago, it's
The
still.
cheese is sliding off the cracker a little bit.
Yeah. And you quit for 24 years. So, and you've quit for a week. Those are practices that will pay benefits if you try to quit again. And the other one, I've smoked so long, there's no benefit to quitting. What we know is, this is based on Surgeon General's report, if you quit smoking, even after 50 years of smoking, even after a heart attack, if you quit smoking, you can cut your risk of a second heart attack in half. Okay? So that's dramatic. It doesn't matter how long you've smoked. And every day, now, so lung cancer risk also declines, but more slowly over time. So all these risks decline at various rates, but every day you go without, you're decreasing your chances of some one of these conditions. Okay? So let's talk just a little bit about the natural history of smoking. There's a beginning, a middle, and stopping, and then resuming for a lot of people. It's kind of the natural history. But do you remember your very first cigarette? Anybody remember the very first one? Can you tell me about it?
Yeah.
Not you, Bill. Go ahead.
I stole them from my mother, Newport cigarettes.
Yeah.
I was probably about in the 7th or 8th grade, and my girlfriend and I were smoking
Okay.
them on the way home.
So it was rebellious. You stole it. You know, curiosity. But go ahead, Bill. What was your?
May I?
Yeah.
At the time, I was going to Los Angeles City College, and I had to take a bus all the way across Los Angeles. And a friend, and you could smoke on buses in those days, and it was boring and nothing to do. And my friend had started smoking Camels, and so he started.
So there was a peer influence. You had a friend who was smoking, and you were curious and bored or whatever. Go ahead, Julie.
I think I was 11, and I prefer to think that I just sneaked it, but stole, sneaked, whatever.
It's a nice
Yeah, a friend and I, my parents weren't home, and I went out and tried to smoke this cigarette and nearly choked to death. But
So it didn't come naturally, you might have noticed. The first one, you felt sick or nauseous or dizzy or woozy or whatever it is. I might as well get to know your names. There's so few that might even be able to remember. What is your name, sir?
Luke.
Luke? Don?
Chris, and we know each other from a few years back.
Yes, you look
I
familiar
was
to me.
Tenorelli. You were my son's counselor.
Oh, Chris. And
Stephanie.
Stephanie?
Yeah.
Okay, Luke, Don, Chris. Yes. Luke, Don, Chris, Stephanie, and Julie. I might not remember. It's curious. It's always challenging for my 63-year-old brain to learn their name. But it didn't come naturally. Anyone else want to share a first cigarette? And you remember it. That's the other interesting thing. After
It
all
went
these
hand in
years.
hand with the alcohol.
Yeah. Yeah.
Yeah, mine was
But
just-
the point is, the first cigarette wasn't, you had to learn to smoke. It didn't come naturally. You felt sick, you felt nauseous. And it was psychological reasons that got you to start. Curiosity, peer influence, rebelliousness, all these, but it wasn't because you had a craving for that first cigarette. It didn't come naturally. That came later, not too long later, because it only takes maybe half a pack to get dependent. But then what happens is a lot of things become associated with smoking and satisfying that urge to smoke. And these are the so-called smoking triggers. So what kind of things now for you can trigger an urge to smoke?
Get out of here.
What's that?
Morning coffee.
Morning coffee?
Get a car.
Right. Driving?
Get out of class.
Right. After finishing a task? Right.
stress.
Stress, internal cue. That counts? Yeah.
Internal and food.
And food? Certain foods, yes. Chris?
Stress, anxiety,
Yeah, anxiety.
boredom.
Those are internal triggers?
Because I notice I smoke way more when I'm bored.
Right. And so all of those things have become paired so often, so frequently, literally thousands of times, that become associated. You've probably heard of classical conditioning. Pavlov's dog is a thing that a lot of people relate to, where you bring out some food and ring a bell, and pretty soon, and the dog will salivate, pretty soon just the bell alone will cause it. The same thing as smoking and a lot of behaviors. These triggers are still there after you quit. That's why it's so hard to stay quit. Because even if you get the nicotine out of your body, you know, when you're driving, God, the cigarettes would feel good right now. Or we know we're having certain foods, or when you feel stressed, it has been associated so often it still is a trigger. So this psychologist, DiClemente, Prochaska, they talked about the stages of change. They did this with alcohol, and I think it applies to smoking too. They talked about these various stages, most of you are probably at least in the contemplation stage. That is, you're thinking about quitting smoking, and probably you wouldn't have come to that. Some people aren't thinking about it, but about 85%, 70 to 85% are at least in the contemplation stage. There's some people who think, what difference does it make? Who cares? I don't care. But that's the minority. You're probably in the if you move into the preparation stage when you actually set a target quit date. Okay?
Yeah.
2025 sounds like a good year.
2025. Okay, it's on your calendar. I'm sorry. Again, it's okay. Again, it's okay. Action is when you get to your quit date and you're actually not smoking cigarettes, or you eliminate some cigarettes in some situations before you get to your quit date. Maintaining once you quit. If you quit for 24 years, Chris, or you quit for 18 months, you are maintaining your non-smoking behavior. And some people actually get to a termination stage. Maybe Julie is there, where she doesn't think much about smoking anymore. But most people occasionally have urges. And one of the reasons is that some of the triggers only occur once a year, like holidays. And when the Aunt Lisa comes over and she's smoking and give me one of those, and that kind of thing. So people aren't prepared for the once a year triggers that are the rare triggers, and they sneak up on them. So you can do some preparation for those ahead of time too, or if they're drinking. Okay, so let me give you a little clue there, but what do you think are the two most common triggers that cause people to relapse after having quit?
Social situations.
With someone else smoking. That's one. Alcohol's the other one. Those two things. So if you quit smoking, it doesn't almost matter how long. If you go out and do some heavy drinking and you're around other people smoking, it is a high risk, highly likely that you will go back to smoking. So that's something to avoid, probably for a while after you quit, maybe forever.
I was going to say for a while. I quit smoking for 24 years. After 27 years and getting a divorce,
Yeah.
I was drinking and somebody handed me a cigarette one night. And that's what started it all.
This is totally consistent with the study we did at Oregon. We looked at smokers. This is how I came up with these two triggers. This is 1975 we published this. I think it was 77. But we interviewed people who had quit for at least a year and gone back to smoking. Everybody remembered, just like you, the trigger and the incident, and those were the two.
And my triggers back then are not the same as they are now.
It might be different now. Yeah. Good.
Yeah, I was just going to ask you a pattern that I've noticed, because you just mentioned this.
Sorry, we're out of time. No.
Was post-divorce. Female patients that I have that have gone through divorce, that often is a trigger too. Why do you think that's true?
Probably because alcohol increased, maybe. I'm guessing.
Maybe. I think it's the association of freedom and independence, which is associated in your mind with
smoking. That's what I was going to
smoking.
say, because after 27 years of marriage, I got married when I was 18.
Exactly.
And
So
after 27 years of marriage, all of a sudden, I didn't know what to do with myself, so I started going to bars and drinking.
And a lot of the
A lot.
a lot of the advertising
Well,
too,
Virginia
is about,
Slims.
Being.
Oh, that's what I used to smoke.
Virginia Slims made their
Yeah.
name on, sort of independence.
Yep.
What was their catchphrase? I can't remember now.
You've come a long way.
You've come a long way, baby. That's what it
Get
was.
where
Yeah.
you got to today.
Right.
Yeah.
Yeah. So you're
That's your
divorced.
own
You
So,
go a long
and
way,
then
baby.
sort of
Go
the male
for it.
version of that is Marlboros and, you know, the rugged independence.
Right.
That's what I smoke now.
Yeah.
But yeah, I mean, because that was interesting because that's exactly what happened. So it became and for I would say 6 months or so I would drink, but I don't know. Then all of a sudden I'm like, well, let me have a cigarette. That was it.
Yeah. Okay, so I'll zoom through some of this stuff. So how do you quit? Well, 3 stages: preparing to quit, quitting, and staying quit. Okay? That's easy to say, hard to do. Setting a target quit date. If you do nothing else, this is the #1 most effective strategy. Even if you don't stay quit forever, pick a day. Pick a day that's meaningful to you. Be your birthday, your mother's birthday, your kid's birthday, Valentine's Day. It doesn't matter. A day that has meaning to you and is really important.
Kick Butts Day is coming up March 15th.
Is that what it is? Okay.
What is it?
Kick
I'm
Butts-
busy that day.
Kick Butts Day.
I'll be busy smoking.
It's this birthday.
Keeping track of your cigarettes is something that most stop smoking programs do, where you just write down, and just tracking causes you to slow down for a lot of people. Getting health information, some of the information I'm giving you today, but that only goes so far. And then learning how to relax, how to calm your body, because a lot of people mention stress, anxiety as a trigger, and just learning to meditate, do hypnosis, the kind of thing that Bill will tell you about, can be very powerful, very helpful. Making a commitment. So this fella's having a struggle with his commitment. Don't get angry, get even. The tobacco company is betting you can't quit smoking. They are betting on it. They don't want you to quit smoking. They will do things like the product placement to keep you smoking for the rest of your life. That's what they want. So if you're the kind of person who's activated and motivated by reactants, if someone says to you, you can't quit smoking, and you say, the hell I can't. Let me show you. Use that to your advantage when it comes to that. Because they don't want you to quit smoking. If they knew it was your quit day, they would send people out to smoke around you to keep you smoking.
I want to work for me.
Someone to hand you cigarettes.
No, I mean, and I'm sure we'll kind of go into this. I honestly don't like smoking. I
Yeah.
hate it. I hate the taste. I hate the smell. I hate smoke.
Right. So for you, it's the nicotine?
It's it's more of a hand-to-mouth action.
Okay, so something about the physical motions.
Yeah, when I quit the first time, I gained over 80 pounds, and I used to weigh over 400 pounds.
Mm-hmm.
So now that I'm smoking, I think part of that is
Right.
I'm afraid to even try to quit because I've worked so hard to get where I'm at that I don't
Right.
want to.
Yeah, the average weight gain is
Yeah.
about 8 pounds. Most people would have to gain 100 pounds to have the same risk. That's but
Because I talked to my doctor about this, and we don't think it's the nicotine. We think it's more just for me, it's hand to mouth.
interesting. So if that were true, gum could work, sugarless candy might work for you, cinnamon sticks. There might be other things that you could do that would satisfy the hand to mouth. That's great. Okay, self-management strategies, stimulus control. What we do, for example, in our stop smoking clinics, the VA, we used to have people specify the situation they're going to stop smoking in before they get to the quit day. So somebody might say, I'm going to quit smoking in my car. Well, how are you going to do that? Okay, I'll put my cigarettes in my trunk. That way I can't reach them. So if we put them in your back seat, you can like this, trying to get to them. So you actually literally have to pull over, get out of your car, which you could do, but you're not going to smoke and drive. That's your commitment prior to your quit day. So people would practice and create situations that make it harder to smoke. Just keeping them in the car when you're in the house. So some people would say, okay, I'm not going to smoke in my house before I get to my quit day. I'll smoke other places. So just practicing. Carbon monoxide feedback. I brought the carbon monoxide monitor. It's an old one. I don't know if the sensor is still working, but if you want to, when we're done with this, I can do a carbon monoxide test. We can see if it's working. It's totally up to you, voluntary. It'll give you feedback on your carbon monoxide level. Hypnosis, aversion strategies. Sometimes you can build those into hypnosis, which Bill does sometimes. And you can also get people to imagine themselves having negative consequences, smoking when they're getting to the quit day. I was involved in some of the original studies on rapid smoking, which is what it sounds like. We'd have people puff every 6 seconds until they threw up. It was a very effective strategy, only I hated doing it. This is when I was in graduate school, about 1973. And I hated doing it because I didn't want to make people sick. That's not why I got into psychology. And so we came up with something comparably effective, but not as aversive, not as nasty, which was taste aversion. We'd have people puff, hold the smoke in their mouth, and not inhale it. And people would say what you say, it tastes horrible. If you do it, if you hold it in your mouth, have them hold it in their mouth for 30 seconds, and then keep doing it, repeat it, and it begins to taste like you've lit an ashtray. On your quit day, when you're trying to quit, you want to have an aversive taste because you don't want it to be as appealing. So that was an effective alternative to rapid smoking. Bupropion or Zyban, the other one they're promoting now is Chantix. I'll give you a little data on Chantix. I think these drugs are over-promoted, and they have many side effects, and they can make you feel a little bit weird.
Psychotic.
Exactly. Just be careful. I am not a big believer in these, neither is Bill. And just for completeness, I include information in this about them here, but I'll tell you a little bit more. This is a stimulus control strategy. Actually, this took this guy to help me stop smoking. You go to places where you can't smoke, church, the movies, gasoline truck, whatever it is that works for you. Contracting. This is where you. I wrote a book on quitting smoke called Butt Out, and in there I have a contract, example of a contract. But what we had. The folks in our Stop Smoking, the veterans in our Stop Smoking class, write a letter. They'd write in their least favorite politician. It could be Hillary Clinton, it could be Donald Trump, it could be Barack Obama, it could be George Bush. It doesn't matter. Your least favorite politician, and you put a certain amount of money, anywhere from $1 to $100, in an envelope with this letter that says you hate their politics, you think they're insane, you would never donate to the campaign. The only way you would do it is if you go back to smoking within the goal period that you've set, and you make it renewing your commitment to quit, that kind of thing. So we'd have them agree to send. It's not the amount of money; it's the symbolic value of sending it to somebody you would never send it to. For some people, that gives them enough incentive. You can think of somebody, a politician you would never want to send money to. I'm sure everybody here can. Well, imagine if your goal was to quit. We would have a short-term goal, like 3 days or a week, and. If you didn't, if you made your goal, you sent the letter off without the money in it. If you didn't make a goal, you sent it off with the money. So that was a way of creating an incentive. Nicotine replacement, patches, gum, they're all very, very effective, a substitute, but only in combination with the behavioral strategies I'm talking about. By themselves, they don't work well. I'll show you one study we did that showed that. Chantix, bupropion, they've used other antidepressants. I just think they're over promoted. They're not very effective, really. Relapse prevention. People are very good at predicting the situation in which they're going to relapse, and so preparing ahead of time for those. So you'll know if you get divorced, you got a high risk, so prepare a plan for handling it.
So quit smoking before you get divorced.
There you go. That's it, so you don't.
Oh, you'll relapse.
Support group can be helpful, and having a partner or buddy can be helpful too. These are the things that don't help. If you're a partner of someone who smokes, or have a family member of someone who smokes, I'm sorry, what is Stephanie? You're here to find out for a friend or a family member? Is it about?
Yeah, I'm just learning.
Yeah, okay. If you have a friend or family member who smokes, don't do these things. Don't hide the ashtrays, don't keep track for them, don't throw away their cigarettes or hide them, don't mention the health risks all the time, don't ignore them, don't mention how easy it would be for you to quit or what's wrong with them, criticize them, all that stuff, complaining about them. That doesn't help. In fact, it decreases the chances that your partner or your family member will quit smoking. What helps, this is an example of something that won't work, it's too aggressive. But what helps are expressing pleasure with their efforts to quit, giving them rewards, small presents, helping calm them down, and participating in some incompatible activity. And, for example, one study showed that just doing something totally non-smoking related, like taking on one of their chores, when they're trying to quit smoking can be helpful. Things that relieve stress and show that you're being supported.
Wait,
Now-
back up, I see one on the other one.
What's
Yeah,
that?
right there, okay.
This one here? You want me to highlight that one?
Parentheses are in all.
Whatever works, you know? Yes, Bill?
Well, I once made an assignment about if you had an urge that would only last about 3.5 minutes or so, and
Right.
you should do anything incompatible like jumping in a shower. And I had one patient who said, I have an ashtray in the shower. It's stuck, it's stuck on it. They don't all
Get
work.
away from it. Yeah. That's funny. So, resumption thoughts, a lot of times people tell themselves, once they've quit, your mind will start playing tricks on you. Like, I think I was happier when I was smoking. You know, nostalgia. But when you think, wait a minute, so you challenge that doesn't seem, that's not accurate. Or testing oneself, I think I could just have one. I've been quit for 24 years. What's the difference in one?
Oh, I know what the difference is now, believe me.
Or there's a crisis. You have a fender bender, whatever. Okay, I really need a cigarette. What's the problem with that logic? I have a cigarette because I had a car crash,
No crisis management.
right? And
You're
also,
relaxed.
your car still crashed,
Yeah, but
and now you're smoking. So it does. So
It
you got
relaxes you though.
well, it's
Contrary to
because
what
it's become
people
associated. So if that's the function, you got to find other ways to relax. You know, like do the hypnosis that Bill does, or the meditation, or like finding you know, or going
I
for
don't
a
want to get
walk.
quiet in here.
So that's the challenge. But a lot of times that's the logic. These resumption thoughts. I really need it right now. I can't. Unwanted effects. I've gained weight. But like I say, you have to gain like 100 pounds for it to be comparable to the risk of smoking. Lack of confidence, I can't do it. Or, and yes, you can, is what I would say. Many people have. Every time you try to quit smoking, you have anywhere from a 10 to 20% chance of staying quit for the rest of your life. Every time. So those add up. Yep. Another common thought is, I'm going to die anyway. What difference does it make? You know, that's
die from them than die on them.
What's that?
I would rather die from them than die wanting them.
Okay, well maybe that's a resumption thought, but the quality of your life is something that should be of interest as well. And so this kind of thought, I'll die anyway. When you're in the middle of dealing with an urge to smoke, it seems so logical. And that's your mind playing tricks on you to try to get the nicotine back in your body. Because you can't be putting on weight already. You only quit smoking 20 minutes ago. But that's the way your mind will play tricks on you. An example of that. This is a study we did at the VA when Bill and I were there some years ago. And it was 10 hospitals, and we randomly assigned patients to either the patch, nicotine patch, or placebo patch. And we did. It was supposed to be a safety study. It was underwritten by the drug company. And they wanted to find out it was safe so they could make it available over the counter, which you see is available over the counters because of our study. But it wasn't effective. The placebo patch didn't do worse than the actual patch in terms of the quit rate. In fact, it was slightly better. It wasn't significant statistically. But these data were delayed. There's a long story behind it, but the data were delayed.
I have to say something nice about Dr. Antonuccio, because it took him, this was in the New England Journal of Medicine, so it was a big publication. He refused to put that date in that it wasn't effective. It took him over a year to get them to publish that they weren't any more effective than placebo.
Yeah, and actually, it was several years.
Was it several?
I can't remember. I think it was, I can't remember. I think it went 2 or 3 years. But yeah, thank you for mentioning that. It was a pain because, you know, the industry didn't want this part of the information out there. They just wanted the information out that it was safe. Thank you, Bill. Yeah, bumper patch. And that's not happening. People don't bum patches. They don't work that way. You put it on and you change it every 24 hours, and it's a way to ease off the nicotine. And you decrease the patches come in different dosages, and you decrease it till you get to a quick day. It's one of those patches that help you quit smoking. And that's not how you use it either. Okay? But you may feel like that's how you want to use it. So, nicotine replacement is not better than a placebo if you do it all by yourself, and it's less effective than just doing behavioral strategies that we're talking about today. But if you combine them, they're better than either alone, whether it's the patch or gum, doesn't matter. They're equally effective in most of these things. So people have different preferences. The advantages of these medicines are that more people are trying to quit, fewer withdrawal symptoms, reduced anxiety. The disadvantages, in my view, there are many. They can be expensive. Sometimes people over-rely on the meds, and they'll start using the patch and they'll smoke. And that could be a bad idea. Weaning from the medications can be challenging. Sometimes there's skin irritation. Some of the meds disrupt sleep. We did a study at the VA also with bupropion, Zyban. It was, but only 20% of the veterans could handle it, and it made them really a lot of them agitated, side effect, can't sleep, cranky.
Long time ago. Yes.
Did you have side? Yeah.
Yeah.
It's really so. That's why I'm not a big proponent of it. I say try it, but use the nicotine replacement. That definitely, you're not adding a new drug to your body, and it will help you in the transition. I'm not going to bore you with this, except to say that if you combine the drug with behavioral support, you got about you're twice as likely roughly to quit than if you just do the behavioral support. Okay, so combining it is the way to go. Don't do the drug by itself, and don't do, you can do the behavioral support by yourself, but if you use the nicotine replacement, you can double your chance of quitting. But the varenicline, also known as Chantix, I want you to see this because what Luke was saying earlier is of concern to me, and that's why I'm not a big proponent of this medication. Almost 3 times as many treatment-related psychiatric symptoms or studies that were done to get this drug approved, 6.8% versus 2.4% compared. So this is the Chantix varenicline versus placebo. So you're 3 times as likely to have a psychiatric side effect, not to mention medical side effects. And Moore found there were 26 FDA cases involving assault, murder, thoughts or acts of aggressiveness, violence. These acts had in common that they were inexplicable, unprovoked, and the victim was anyone nearby, no prior history, and even occurred before stopping smoking. So it wasn't just from the withdrawal. So be cautious. If you try Chantix, be on the lookout for unusual behavior and stop it if you find yourself going down a rabbit hole that you don't think is normal.
Aggression is a really big one.
Sorry, Bill. Can I go 2 more minutes?
Oh, sure.
So
I don't mind having no time to talk.
So if you use the patch, set a target quit date, use CO feedback, all the things I've been talking about. If you go to a behavioral program, I'll give you a handout. There's a couple in town. The VA has some. American Lung Association has some. There's a known it's a Nevada quit line you can call and participate. The patch, we did a study that showed 3 weeks on the patch was just as effective as 12 weeks on the patch. Department of Health and Human Services is advising all physicians to ask people, so your doctors may be asking you about it, advising them to quit, because advice can stimulate some people to quit. See how motivated they are, which stage they're in, and assist them if they can with nicotine replacement and follow up. There are some smoking cessation websites that you can access. These are the top ones. They're can be very helpful. And the WHO, World Health Organization, is recommending that we do what we can to protect people from smoking and help them quit, warn them about the dangers, etc. So it's consistent with what our government agencies are. These things do seem to actually reduce the amount, even though they're irritating to smokers, they do seem to reduce the amount of smoking. Sometimes people, when taxes go up, they say, I refuse to pay that much for a pack of cigarettes and I'll quit. And a certain percentage of people do that.
That was when they were 50 cents a pound. 35 cents a pound.
Now they're 5 something.
And if you want to, there are even sites that will allow you to calculate your cancer risk, depending on how long you've smoked, and they will show you a graph for how your cancer risk decreases if you quit. So you can actually see it. It's kind of cool. You can go, there's a couple of sites online that do that.
Some things are better left unknown.
All right. Well, but the positive aspect of that is you get to see the benefit you get if you quit. You can see how much it decreases. Okay, so that's one reason to look at it. So these are the main resources for quitting smoking, for assistance quitting smoking. And I have a handout that has this information on it.
Okay.
I'll just give it to you. I wrote a book on it. Robert Shipley, another VA psychologist, wrote a book on it. Freedom Smoking has American Lung Association has a book as well. That's it. I'll turn it over to Bill.
David, did you?
Can we have a smoke break now?
Yeah. You want to have a smoke break? No.
The B.
Christine's going to realize these for you and then she'll bring it back to me because she's just out. Thank you so much.
Okay. That's it.
I hope that's it.
That's it. That's it. So, what have you all heard about hypnosis and smoking cessation?
Not much, and this is what I talked to Juliet because I've done the patch, I've done the gum makes me sick, the Chantix made me freak out. Zydan way back in the day didn't work because I've been smoking for a long time. I have a target date, and that's when I turn 55, and that's this year. So, but it's hard because I don't have that self, I guess, control.
So you think it's going to be tough?
Well, I know it is because there's nobody there to, my dogs don't say stop doing it. But I'm just saying that, there's nobody to control but me. So this, to me, I've heard will work, but you have to want to.
Okay.
So
That's pretty
it's the last
straw.
It's the last straw. Last cigarette.
Well, I hear that a lot about hypnosis. Sometimes it's considered to be the magic bullet, that's going to do it. I know you're not saying that, but some people do believe that. And sometimes that's actually true. David and we had a patient, he was an older guy who smoked 3.5 packs of cigarettes a day, woke up a couple of times every night just to smoke a cigarette. And after his hypnosis session, he said he had absolutely no urge and he stopped. Just stopped. And I was delighted by that. About a month later, I saw him out in front of the hospital smoking a cigarette. And so I walked up to him and I said, well, I thought this was like really easy and all your urge was gone. And he goes, yeah, doc, if I realized how easy it was, now I can stop anytime I want to. So sometimes the silver bullet is a double-edged sword, to mix metaphors. Research on hypnosis and smoking before the 60s is practically non-existent. After the Surgeon General's report, there's a bunch of studies that are done, but they're not very good studies. There are no control groups and no follow-up. And I went back and looked at some of the, and yeah, they did call them tobacco maniacs. And sadly, my picture was the only one I could find tobacco maniacs. So, anyway. So what kind of approaches did they use in these early studies? Well, direct suggestion, and that would be something like when you leave my office, you're not going to be a smoker and you'll have no urge to smoke. That's not very effective, needless to say, few people. Sometimes the hypnosis would involve increased awareness. So whenever you started to get an urge to smoke, you'd be more aware of that urge and be able to thwart it in some way. This is still the kind of post-Freudian day. So they believed that people who had trouble stopping smoking were stuck in the oral stage of development, and if you regress them, you could somehow fix that.
or regress them to when they started smoking and give them a chance to make a different choice. That doesn't work either, by the way. Substitution, David mentioned that in hypnosis, that would be every time you have an urge to smoke, the idea of a lifesaver might pop into your mind, for example, or something else. This was kind of an innovative technique that Milton Erickson actually came up with. And the technique is called My Friend John, and what we would do there would be put somebody into a trance and then have their personality split off into this other person who would tell them how they were successful in stopping smoking. So it's a projected technique, it comes from your own mind. This is what might work for you.
Then my insurance can pay for my personality disorders.
Yeah, and then you get a second
I'm
chance.
Gemini, I already got two of me.
I was gonna say, what's the other thing gonna do?
So before I get to kind of modern era research on hypnosis, I'm going to talk about hypnosis per se, what it is, what are some myths about hypnosis. We'll take a look at hypnotic suggestibility and also talk about it being used as a clinical tool. So this is the boring definition of hypnosis. This is the definition of hypnosis that makes everybody happy in the research field. It's the state of inner absorption, focused attention, and alters some aspect of thought, emotion, behavior, or perception, which is so damn general it's practically meaningless. This is a more user-friendly set of definitions. It's using your mind to help yourself, learning how to control the mind-body interface, daydreaming or meditating with a purpose, learning what you didn't know you knew, and controlling what you didn't know you could. So these are some common myths about hypnosis, that people in hypnosis lose control, and they can be made to do or say things, whatever the hypnotist wants. People may get stuck in hypnosis. Hypnosis only affects weak-willed or gullible people, and actually, highly hypnotizable people are less likely to respond to placebo than low hypnotizables. So suggestibility is not gullibility. They're not the same thing at all.
You're not going to make me walk like a chicken.
Later. Always at the end of the show.
Every time you hear that word.
So, hypnosis reliably enhances the accuracy of memory. Okay? Well, yeah, but it also reliably distorts memory. So an example of this is if you, let's say, happen to be outside, unfortunately, after a bank robbery, and the police say, well, let's hypnotize this witness and see if they can remember the license plate number. So I hypnotize you, and I say, you're standing outside of the bank, and you're looking at the getaway car, and now you're looking down at the license plate. What does the license plate read? And you give me a number. In hypnosis, I just created a getaway car, created a license plate, and the number you gave me, you will come to believe is the truth, and you can pass a lie detector. So there's a real problem with suggesting things to people, and a lot of the work on false memory and so forth was because of this effect, that overzealous therapists would say, oh, you've definitely been molested or whatever, and then would give leading suggestions to people to make them believe that. Huge increase.
Yeah.
Right. Which
Don't
unfortunately...
you know you're not supposed to talk to the cops?
Yeah, I have heard that, yeah. Don't ever get started, right? That enables people to re-experience past lives. And that's, again, one of those suggestive effects where if you say that to somebody, you can make them believe that that's the case. And that it depends on the skill of the hypnotist. That comes from the old you're under my spell kind of days, and really it's the skill of the person being hypnotized. So none of these statements are true as written. Here's what patients say, though. Some people will say, well, what if I don't wake up?
Right on.
So that might be a good thing sometimes. But I've been doing hypnosis, clinical hypnosis, for 40 years. I've only had that happen twice. And one of the times was it was a medical school group, and the woman that had volunteered for the hypnosis didn't wake up when I suggested she wake up. And I dismissed the other people in the class and asked her what was going on. And she said, I'm in therapy, and I remembered something when I was hypnotized, and I'm worried if I wake up, I'm going to forget it. And I said, would it be okay if I suggest to you that you will, next time you're in the company of your therapist, that you'll remember that? And she said, sure. And she woke up. So oftentimes there's a motivation. Somebody may be enjoying the experience, and you can, in hypnosis, you can speed up time and have them enjoy the experience more quickly. So often there is a motivation when people don't, well, there's always a motivation when people don't wake up. Embarrassing yourself. I have never had that happen in all the years of doing hypnosis. Had anybody ever embarrass themselves? Embarrassed me, but they never embarrassed themselves. Sometimes people they have ideas about what it's like to be hypnotized or be in a trance. Like, I heard everything you said, and I once saw a mother and her grown son for smoking cessation, and I saw them back to back. So after the mother had finished her hypnosis, she said, I don't think I was hypnotized because I don't remember anything you said. After the son woke up, he said, I don't think I was hypnotized because I remember everything you said. So I suggested they go outside and talk to one another about that and clear it up. So the other thing is they're worried they're going to be controlled in hypnosis, or they're going to remember something they don't want to remember. And I don't think either of those things really happen. I think as a general statement, you can say, makes it easier for people to experience suggestion. It doesn't force them to have these experiences. And people don't lose control. They remain aware of who they are, where they are, and they generally remember what transpired, unless there's a good reason not to. So, who can be hypnotized? And if you just look at hypnotizability, how do we measure that? We measure that by hypnotizing people with a standard induction and then challenging them with a set of challenges, like, your arm has got a metal rod in it and you can't bend it, try to bend it. Okay, and hypnotized people will try to do that, but they won't be able to. So if you use a standard scale to measure hypnotizability, about 75% of people can experience some level of trance. Okay, and about 48% fall in this big curve here. And then there's this group over here, this little secondary camel hump. And these are people who we call somnambulists. They go into very deep hypnosis and can do extraordinary things. And often these are the people that get picked for stage shows, and some of the early research that showed these incredible things you could do with hypnosis are usually those folks down there. But most people can experience some level of trance. So I'm going to give you a little demonstration of this just so you can assess this yourself. And one of the ways of looking at this is called the Orn-Harding test. And here's how we do this. Just put your hands out in front of you like this, with your hands separated by about 2 inches. And then close your eyes and focus on the 2 arms. And one of them will feel just a little bit lighter than the other one, which is normal. Now, focusing on the light one, each time you take in a breath of air, that arm gets just a little bit lighter. And each time you breathe out a breath of air, your heavier hand gets heavier. So do that for about 10 breaths with your eyes closed. The lighter hand getting lighter when you breathe in, heavier hand getting heavier when you breathe out. And then when you've finished about 10 breaths, just open your eyes and look at your hands. Okay. Anybody surprised by the hands? Anybody's hands opposite of where they thought they were going to be? Okay, so that's one test it's called idiomotor response. And what that means is translating a suggestion into a motor behavior. There's a simpler version we can do, which is just press your hands together like prayer pose. Press the palms together as tightly as you can, and then separate your two fingers, front fingers. And then focus on that line that you see between those two fingers. And I want you to vividly imagine that a very powerful magnetic field is pulling those two fingers together. Make sure your palms are pressed tightly together. And just look at your fingers, look at the fingers, and vividly imagine that there's a powerful magnetic force pulling them together. That's right, just like that. Okay. So that's another example of an ideomotor response.
I don't think my imagination's.
It's not working. Well, here's the interesting thing about this. In the early days, they used to say that hypnotizability was fixed, that everybody about 6, 8 years of age had a hypnotizability quotient, and that didn't change, and it was even more stable than IQ. The problem with that was it relied on this research that used a standardized induction. So I'd have you look at a spot and keep looking at the spot, and it appears to move to the left or move to the right, or it becomes blurry and your eyelids become heavier and heavier, your eyes close, and so on. So after using that standard induction, I would do a series of challenges, and then I would give you a rating of how hypnotizable you were. Now the problem is that only measures how responsive you are to that kind of an induction. It doesn't measure, and there are more elegant styles of hypnosis that use whatever you bring to the hypnotist to increase your hypnotizability. And one of my mentors, Lou Sachs, did some of the early research that showed you could change somebody's hypnotizability, you could train them to be more hypnotizable. So. This is another experiment. We don't have time here, but you can do this at home. Chevreul pendulum. And all you do with this, get a piece of thread and a washer, something heavy, tie it on the end of the piece of thread, and hold it out at arm's length. And you take a piece of paper and draw a circle on your paper and a plus sign. And then you just ask the question, what kind of movement will stand for a yes answer? And all this does is it amplifies an unconscious tendency. So for me, it'll begin to swing this way. And if I say what'll stand for a no, it'll go this way. And I don't know is clockwise, and I won't say counterclockwise.
And that will depend on each individual person.
Each person has a different kind of response to
You
it.
use that with the needle and the thread over the person to see if you're going to have a boy and a girl.
Oh,
or how
okay,
many
there you
kids
go.
and what gender, which is suggestive then apparently.
Yes. Yeah.
Gotcha.
So it's very interesting. I found I've lost a Swiss Army knife one time, and I used that technique to find it, and it actually worked. I asked, was it in the house or outside, and was it upstairs or downstairs, and then we get these answers, and then I found it. So,
Last place you looked.
last place I looked, last place I left it. There are some contraindications to hypnosis. First of all, it shouldn't be used by any practitioner for a problem that that person's unprepared to treat without hypnosis. And that's one of the reasons the professional organizations are against lay hypnotists, people who have only been trained in the use of hypnosis. Because without the training in mental health, behavioral sciences, dentistry, or medicine, you're really not prepared to treat underlying problems that may come up in hypnosis. One of those problems is inadvertent suggestion. And this was an interesting situation that I ran into. It was a man who came to stop smoking, and he said, you know, I'm really kind of uncomfortable with hypnosis, but I think I'm a good subject and I want to use it. And I asked him what happened. And he said, well, he had discovered that his wife was having affairs, I'll put this nicely, with a couple of his friends, and he was going to confront her about this and divorce her. And before that happened, some friends of theirs, another couple, got tickets to one of the stage shows in hypnosis. And so they agree to go with this other couple. They go to the stage show. And as luck would have it, both this man and his wife end up on stage. And it's one of those kind of saucy hypnosis shows, with all the suggestions and all this kind of stuff. But the wife ends up saying something very incriminating on stage. And the hypnotist walks over to my patient and whispers in his ear, because she's worried that he's probably going to sue her or something, or get a divorce from his wife, doesn't know he already knows what's going on, and says, just forget everything you heard. Well, he's already torn. He doesn't really want to divorce his wife, so that suggestion he acts on. He forgets what he already knew. And the hypnotist didn't know that he already knew it. So he said, I spent about a year having these dreams about that hypnosis show and being bothered about it. There was something was terribly wrong before I finally remembered what she said to me. And they did end up getting a divorce. It's a sad ending, I guess. The other inadvertent suggestion was my error, and this was a person who came to me to stop smoking. And she said, I really love smoking cigarettes. I really enjoy it. I don't want to stop, but my father just had a heart attack, and I have heart problems all over my family, and I know I have to. So I thought, well, I better really pull out all the stops on this, because it's going to be tough. She's going to have a tough time. And so what I suggested to her was, I don't do this anymore, by the way, what I suggested to her was, your unconscious mind can come up with whatever's necessary for you to be successful. Sounds simple enough.
Myocardial infarction.
Exactly. And so what happens is she leaves, and she calls me the next day, and she goes, you're not going to believe what happened to me, which is something a clinician never wants to hear in a phone call. And I said, well, what? And she said, well, I left your office, and I went out to the car, and I lit a cigarette just to prove I could still smoke. And then she said, I got disgusted with myself, and I put it out, and I drove home, and I'd seen her like in the late afternoon. She went home, had a glass of wine, and went to bed. And she said, in the middle of the night, I woke up with these horrible chest pains. And I tried to dismiss them at first, but it got worse and worse. And finally, I called an ambulance. And the ambulance took her to what was then Washomed. And the doc there examines her, and he goes, well, lady, you're not having a heart attack, you're having an anxiety attack. So she said, at first I was really pissed at you, and then I remembered on the way over there in the ambulance, I made a deal with God. I said, God, if you let me live through this, I swear I'll never smoke another cigarette. And she didn't. So that's a pretty extreme. I would never have suggested that to somebody, and I'm a lot more careful about open-ended suggestions these days because of that. Other possible problems: abreaction. If people have a history of trauma where they've dissociated, which happens sometimes, sometimes hypnosis can take them back to that trauma and they re-experience the trauma. And that can be a very scary situation that requires time to calm the person down and deal with whatever the crisis is. So the other thing we want to be careful about is serious mental health problems. And this is another smoking cessation case. And this was a lady, maybe in her mid-40s. And so she came in to stop smoking. And I had hypnotized her, and I was looking at my notes. And as I'm looking at the notes, another voice in the room says, what's she doing here? And I thought somebody else had come in the room. And I looked around, nobody else was in the room, and I said, who are you? And she identified herself as another personality. And I said, she said, why is she here? And I said, well, she's here to stop smoking. And I said, can you help her do that? And she said, yeah. And I said, okay, will you? And she said, sure. And then I'm thinking ethically, this woman didn't come to see me with multiple personality. So I can't really bust her. I mean, she's in her mid-40s. She's lived her whole life with this other personality. She probably has clothes she didn't buy in her closet and so forth. So I said, look, since I know about you, if you ever have any kind of problems or you need my help, will you feel free to call me? And she said, sure. And she left. About 2 weeks later, I got a phone call from this other personality, and she said, you know, we're going in for some elective surgery, and I'm very worried I'm going to come out during the anesthesia. Could you talk to the doctor? And I said, sure. So I called, I ended up talking to the scrub nurse, but I told her that this person you're going to be seeing has a multiple personality. And that was the last I ever heard from her. So, a very interesting situation. The other thing to be careful of is somebody with paranoia or a delusional disorder, because you can get sucked into the delusion. If they have a little bit of missing time from the hypnosis, what did you suggest to them during that time? So you have to be very careful with that kind of thing as well. So there are two components of a hypnotic procedure, an induction and suggestions. And so an induction, you're guided through some suggestions just to relax, concentrate, usually to focus your attention on something. And some hypnotists believe you're doing this to induce an altered state of consciousness. I do. Some believe that it's simply a social cue that prompts somebody to engage in hypnotic behaviors, whatever they think hypnosis is supposed to look like. Suggestions can be suggestions to undergo changes in experience. And there are different types, generally divided into these. Idiomotor suggestions, which we had an example of with the Orne-Harding test. And challenge suggestions, such as the you can't bend your arm or you can't open your eyes kind of test. Also cognitive suggestions, and this is where the smoking cessation comes in. Experience changes in sensations, perceptions, thoughts, or feelings. These are all tools that we use. Hypnosis by itself is going to increase the intensity of the experience for the person. We know from PET scans and so forth and EEG studies that there's more amplitude associated with hypnotic suggestion. People, their experience is closer, for example, to actually looking at a picture if you suggest they're looking at the picture in hypnosis than if you just tell them to imagine they're looking at a picture. So it's a more intense experience. Idiosensory, we kind of covered that. The indirect suggestion is used much more often these days than direct suggestion. So the problem with direct suggestion, if I say to you when you leave here, you're not going to have any urge to smoke. And you walk out the door and get a little whiff of tobacco smoke and you think, well, that didn't work. So it's kind of completely blows it out of the water. It's undone. Indirect suggestion kind of goes around conscious thought. So you can't challenge it directly. If I say, the next time I see you when you've been free of tobacco for about 3 or 4 days, we're going to do some additional work on that. I've indirectly suggested that this is going to be the case. And it's harder to fight that, I think. Metaphor is a way of telling stories to people that guide them through changes in behavior. Time distortion might be used in hypnosis to decrease the perceived length of time you have an urge to smoke and increase the time you feel comfort. Sometimes we might induce dreams, and an example of this might be to have you go forward in time in a dream to, if you continue to smoke, what's the ultimate outcome of that? Sort of like David showed you the aging program that takes people's faces and ages them. You can do that in hypnosis as well. And finally, and I think very importantly, is the changing in belief, that people can believe something's happened to them and that they can be successful. That's really, really important. Placebo effect. And I think hypnosis is a benevolent placebo, unlike the drugs. Oh, there we go. Says, gee, I don't know. I guess if I had to choose between you, I'd say Jerry's formula has the most hideous side effects. So hypnosis is a clean placebo at worst, as opposed to some of these other drugs and so forth that have very bad side effects. So as a clinical tool, we use it in two different ways. One of them is making suggestions for symptom reduction. That could be a direct suggestion or an indirect suggestion. And also using hypnosis as an adjunct to other forms of therapy, such as cognitive behavior therapies. So a direct suggestion might be you're going in for a lumbar puncture, and I suggest to you that your back is numb and it's like a block of wood and you can't feel anything. That would be an example of a direct suggestion that's a classic use of hypnosis.
Positive persuasion.
Exactly. So in cognitive behavior therapy, we know from Hirsch's work that the use combining hypnosis with cognitive behavior therapies improves outcomes for about 70% of patients who use CBT alone. And the standard techniques can be presented in a hypnotic context after a hypnotic induction. So here are some examples. Progressive muscle relaxation, which is a non-hypnotic technique, becomes hypnotic relaxation after an induction. Guided imagery becomes hypnotic imagery. And here's an example of this. I might have you, while hypnotized, put yourself in a movie theater, and you're looking at the screen, and the screen is divided into two halves. And on the left part of the screen are irrational thoughts that you might have. And on the right side are the rational thoughts that counter them. So an automatic negative thought might be, I can't do this, I can't resist the urge to smoke. And what you might then see materializing on the other side is, I may feel anxious, but anxiety always passes. Anxiety is uncomfortable, but it's not going to hurt me. I can use self-hypnosis to control my anxiety. So these would be rational thoughts, and then I would have you imagine that this other side simply vanishes.
Get the ants out of there. Get the ants out of there.
Get the ants out of there, right? So, with hypnosis and smoking, it is effective, but it's variable. The problem with this research, if you look at like some of the big databases, the Cochrane database, for example, I think 2008 and 2010, Cochrane looks at what are examples of treatments that are empirically validated by good research. And they didn't find hypnosis to be particularly effective. Here's the problem with early research. If I ask you the question, how effective is medication for getting rid of headaches?
Depends on the headache.
Right.
Right. So if I take all the research on all the meds and put it all together, all the meds that have been tried with headaches, they kind of cancel each other out. And you end up saying, well, medication is variable. Sometimes it works, sometimes it doesn't work. The question isn't that. The question is what medication? Big difference between an antihistamine for a headache and an aspirin for a headache. So the real question might be, how effective is aspirin? How effective is an antihistamine? And same thing with psychotherapy. Asking the question, how effective is psychotherapy for anxiety disorders? Well, what kind of psychotherapy? And that's the same thing with the hypnosis. What are you doing with the hypnosis? Hypnosis is just a vehicle. It's not a treatment. So, as a treatment, it's difficult to research. It's really hard to do double-blind studies with hypnosis because people know what's going on, and it's difficult to comprise control groups and so forth. It's differentially effective with different groups of smokers. So this is an interesting study that was presented at a meeting, CHEST. These are American College of Chest Physicians, and these were patients being treated inpatients. And hypnosis and nicotine replacement therapy with hypnosis were 50% effective And this is just the nicotine replacement, which is less effective here than the control. Okay? Very interesting. These guys found that cardiac patients were 4 times more likely to succeed with hypnosis than pulmonary patients were. Why do you think that would be?
Fear of death.
Hmm?
Fear of death.
Okay, so yeah, the cardiac patients have probably had a hell of a time. They've probably gone through a heart attack before they come in the hospital. So, they've got the fear of God in them, and that's going to motivate that. The other thing I've noticed too, though, a lot of times people with COPD or breathing problems are much higher anxiety than the cardiac patients are. And I think that's because trouble getting air and so forth, it just kind of lends itself to that. So this is a wonderful little study that was done at San Francisco VA and in 2008, and decent sample size, and they wanted to know whether hypnosis was more effective than standard behavioral counseling when both of those were combined with nicotine patches. And these were the outcomes here. So hypnosis, this is self-report at 6 months, and this is self-report for just the behavioral intervention. And then this is with proxy, and that means where they actually did biochemical testing to make sure people were telling the truth, so that they weren't smoking. And so these are the same data backed up with biochemical testing. And then at 12 months, hypnosis still was significantly better than the behavior therapy alone. The other thing they found in this study was that patients who had been diagnosed with depression were far more likely to be successful with the hypnosis intervention. So this journal, the American Journal of Clinical Hypnosis, did a whole issue in 2010 on smoking cessation and critiques of the research that had been done. A lot of the problems were randomization of who was included in the study, getting adequate sample sizes, using some kind of well-defined manualized hypnotic intervention. Because again, we're talking about measuring the intervention, not just whether they used hypnosis or not. And then a clear delineation of treatment population. And you saw this study on folks with cardiac diagnosis versus pulmonary diagnosis. And also there's another study that showed that men had about a 7% advantage over women with hypnosis in smoking cessation, which is sort of strange, but the author of that study said probably the reason for that was women were less responsive to nicotine replacement than men, and women were more concerned about weight gain than men were in this study. So the bottom line is, I think you can accurately inform patients that there is a bump with hypnosis, that it can improve intervention. It's not, if you call some of these treatment centers, they'll tell you it's like 90% and 80% effective and so on and so forth, and that's just not the case. But it can give you a 10% advantage over other treatments. I think you could reliably say that. For people, especially people who are on the higher end of the hypnotizability scale. And I'll conclude with giving you some websites also. These are professional organizations that in the hypnosis community. So this is the American Society of Clinical Hypnosis, Society for Clinical and Experimental Hypnosis, and the International Society for Hypnosis. The Erickson Foundation and American Psychological Association Division 30 is psychological hypnosis. All of those websites have some information on hypnosis and smoking cessation. So.
Do you have a handout?
No. Because
I'm
I'm just not on my game like I'm trying to reach you. Anyway, so you want to come up here, David? Any questions anybody have about anything we've said?
I really liked your presentation.
Well, thank you.
No, thank you.
Here's the easiest way, just take a damn picture.
Oh, there you go. Yeah, take a picture.
You know, I am so old-fashioned. In my next life, I will be a computer person. This one,
Does anybody want to do
Be careful
seal
what you
monitoring?
ask for.
Anybody
I would
want
like
seal
to.
feedback?
Now, it's true, isn't it true though that not everybody is hypnotizable?
Correct.
I don't think I am, but
Yeah, I was told I couldn't be hypnotized.
Really? Well,
Oh, don't take that.
I love a challenge.
That's kind of like this whole thing that they're trying to do on campus about us, stop smoking. It makes me want to smoke even more.
Yeah. Well, it brings it to mind. It's like David was talking about. It's another cue. Like, oh, don't forget smoking.
Yeah.
It's like.
Well, when people
I
tell
have
you
gun
not
in my